Welcome to our channel. In today's video, we're diving deep into knee pain, understanding its causes, sharing effective tips to manage and alleviate it, and highlighting key vitamins that can support your joint health. If you or someone you know is dealing with knee pain, stay tuned to learn how you can take control and live a more comfortable, active life. Chapter 1. Understanding knee pain. Knee pain is a common complaint that affects people of all ages. It can be caused by a variety of factors, including injuries, such as ligament tears, meniscus injuries, and fractures, medical conditions, arthritis, gout, and infections, mechanical problems, such as dislocated kneecaps or hip or foot pain affecting knee function. Common symptoms: swelling and stiffness, redness and warmth to the touch, weakness or instability, popping or crunching noises, inability to fully straighten the knee. Chapter 2. Effective tips to manage and alleviate knee pain. 1. Rest and protect RIC. Method: rest, ice, compression, and elevation. This method is particularly effective for acute injuries. Avoid overexertion. Give your knee ample time to heal before returning to high-impact activities. 2. Exercise and physical therapy. Strengthening exercises. Focus on quadriceps, hamstrings, and calf muscles to provide better support for your knees. Low-impact activities. Swimming, cycling, and walking can help keep your joints flexible without adding extra strain. Stretching. Regular stretching improves flexibility and reduces stiffness. 3. Maintain a healthy weight. Extra weight increases stress on your knee joints. Losing even a small amount of weight can significantly reduce knee pain. 4. Use proper footwear. Shoes that fit well and provide good support can help align your leg and reduce knee strain. 5. Pain relievers and anti-inflammatories. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage pain and inflammation. 6. Injections and advanced treatments. Corticosteroid or hyaluronic acid injections can provide temporary relief from chronic knee pain. Chapter 3. Essential vitamins for knee health. 1. Vitamin D role. Promotes calcium absorption for healthy bones. Sources: sunlight, fortified foods, and supplements. 2. Vitamin C role. Crucial for collagen formation, which is important for cartilage health. Sources: citrus fruits, strawberries, bell peppers, and supplements. 3. Vitamin E role. Anti-inflammatory properties that can help reduce knee pain. Sources: nuts, seeds, and green leafy vegetables. 4. Vitamin K role. Supports bone health by aiding in the regulation of calcium. Sources: green leafy vegetables, fish, meat, and dairy products. 5. Omega-3 fatty acids role. Reduces inflammation and may help with arthritis-related knee pain. Sources: fatty fish like salmon, walnuts, flax seeds, and supplements. 6. Glucosamine and chondroitin role. Supplements that may help rebuild cartilage and relieve symptoms of arthritis.